Hello, my name is Dr. Caronia, and I'm the chairperson for the Department of Pediatrics for Catholic Health. And today I'm here to speak to you about keeping your child safe. The age of 3 to 5 continues to be a challenging age. Your child goes up and down stairs without support, is able to hop and stand on one foot, moving forward and backward without difficulty. They may at this age even be able to open up their car seat. They swallow anything, and they are fascinated by fire and water. The safety check for this age group will keep you in check. Your child may be ready to now at this age ride in a toddler seat with the seatbelt properly attached. Please refer to each individual toddler seat based on height and weight of your child for appropriateness. Do not allow your child to ride their bicycles, tricycles in the street or near traffic. Hold on to them when going anywhere near a street. They can run and will run without regard for danger. Guard against falls from equipment when on playgrounds such as slides and monkey bars. The stairs would be better served to continue to use the gates at the top and bottom of the staircases, and continue to use window guards to prevent falls. Burns and fascination with fire, keeping matches, cigarette lighters out of the child's reach. Drowning at this age continues to be a problem. Never leave your preschooler unattended near water, even if he or she knows how to swim. At this age, poisoning remains problematic. Children can eat and put anything that they find in their mouth. The recommendation is to ensure that you have the toll-free poison control helpline number saved in your phones in the event that you may ever need them. The number is 1-800-222-1222, and they will connect you with our local poison control helpline, which will provide you with detailed instructions on the care of your child. I hope that the information that I've been able to share with you today will keep your young child safe. If you have any questions, please visit our website for Catholic Health. Thank you.